As part of our Voices for Equality series, we're digging deeper into vaccination equity here in Georgia. As part of our Voices for Equality series. And the Kaiser Family Foundation found white people are about 1.5 times as likely to be vaccinated than African Americans, and nearly 4 times as likely to be vaccinated than Hispanic people here in Georgia. Joe Ripley explores one nonprofit's efforts to try and level the playing field.
It offers peace, it offers tranquility, it offers the chance to see your friends and, the chance to hug my mother.
Wesley Castillo called the COVID-19 vaccine a step back to normalcy. But that step, he says, comes with seeds of doubt in his community.
There's a lot of hesitation with new things. Anything new is like, well, we got to wait a little bit and see what happens,
The Kaiser Family Foundation noticed a pattern in people of color. They received a smaller share of vaccinations compared to their shares of COVID cases, deaths, and total population. Minorities accounted for 48% of cases in Georgia, 42% of deaths, and comprise 46% of the population. Yet people of color only represent 31% of those vaccinated.
To accomplish equity, you have to be very active. It's not going to happen passively.
That's where CORE comes in. The nonprofit specializes in disaster relief, working with local health boards, churches, and community leaders to test, contact trace, and now vaccinate people of color. Area Manager Sam Archbold says CORE has set up nearly a dozen mobile clinics across metro Atlanta.
There's always going to be some trust barriers between government entities and some discriminated populations. So by having a nonprofit private entity be able to come in and really help bridge those gaps has been a kind of corner that we've been able to find ourselves to serve very well in.
Fulton County has given CORE around $9 million. County Commission Chair Rob Pitts and other health officials say the partnership with CORE and expanding education efforts around the vaccine will help create a more even playing field.
Our in-house efforts through our Health Equity Initiative, our partnership with CORE, we're making a dent and beginning to serve those communities.
The vaccines are the way out. And we really want to make sure that every resident of Fulton has equal access.
Wesley Castillo believes the easier it is to get a vaccine, the more people will get one.
Just knowing that it's available is huge. So the fact that there's a mobile clinic and they're not just waiting for people to come to them, but they're going out there is critical. That's huge.
Extremely helpful there. And the Kaiser Family Foundation suggests some of the best strategies for vaccinating underserved communities include allocating more doses, prioritizing appointments for those who need the most help, setting up call centers, locating clinics in those communities, and working on vaccine education. Chesley, on over to you.